All right, so this is my Meniere's disease presentation. Meniere's disease is a complex progressive disease of the inner ear labyrinth. As you can see here, I have it circled. It typically affects the inner ear, which is really considered the cochlea, as well as the cochlear nerve. On this slide, I have a link to a YouTube video from a doctor of audiology explaining the ins and outs of Meniere's disease, which can be a little bit more of a helpful reference. According to the Mayo Clinic, most cases of Meniere's disease only affects one ear, whereas some people can have a bilateral case. They might start out unilaterally and then it becomes bilateral. In our O'Sullivan book, it states that Meniere's disease is confirmed by documented low-frequency hearing loss and episodic vertigo. The signs and symptoms are recurring episodes of vertical hearing loss, tinnitus or ringing of the ear, feeling of fullness in the ear. So Meniere's disease does not have a cure. So a lot of the medical treatment is to reduce or prevent the fluid backup, which is typically built up in that cochlear part of the inner ear, which is why the patient why the patient only has issues in one side as not the other. For a PT, there's not much that can actually be done to control this disease. There are gaze and postural stability exercises that can be performed. The gaze stability is to improve vestibulo-ocular reflex and other systems used to assist gaze stability with their head motion. This is used to also help expose the patient to retinal slips that typically result in blurry vision. This is so whenever it happens, they are able to accommodate themselves and get their equilibrium back into kind of place so they're not so disoriented. The postural stability exercises are to help improve their balance by encouraging balance strategies to help their limitations. So it could be somewhere within their somatosensory, their visual or vestibular systems. That's almost one of the compensatory ways that patients can overcome Meniere's disease. Their treatment of disequilibrium occurring after a vestibulonectorectomy or a chemical ablation to help, so those are like surgeries to help overcome the treatment. And the disequilibrium is the lack or loss of their equilibrium or stability. Pharmacology, also nothing really that so much helps the patient in overcoming this disease. The motion sickness medications like meclizine or diazepam, which is more known to us as Valium, is there to help reduce the spinning sensation and help potentially control like their nausea and vomiting. The anti-nausea medications are promethazine. It can help control the nausea and vomiting during one of their episodes. The use of the diuretic or to help decrease the fluid retention is used so that there isn't as much fluid buildup within their ear. And then the patient can also get shots in their inner eardrum. These include gentamicin, which helps reduce balancing function of the inner ear, and so say it's in their right ear, their left ear will then assume the responsibility for balance risk for the responsibility for balance. So instead of relying on the right and left side, the patient would only rely on either their right or left side. This shot provides a large risk for a great loss of hearing, which also can come along with Meniere's disease, especially the longer that the patient has been diagnosed with it. Another shot can be a steroid or a cortisone shot. This can be like dexamethasone, and this can help control their vertigo attacks, but it does not increase the risk for hearing loss, so it's a little bit safer in the long run. Surgery-wise, the patient might have an endolymphatic sac procedure. This plays a role in regulating inner ear fluid levels. In the procedure, the sac is decompressed. And then in some cases, they might place a shunt within the ear to help with like fluid drainage, so it should last a little bit longer. There's the labyrinthectomy. This is where the surgeon removes the balance portion of the inner ear, therefore removing both the balance and hearing function from the affected sides. This isn't typically done with every patient. The patient needs to have near total or total hearing loss affected in their ear. And then the vestibular nerve section is where they cut the nerve that connects the balance and movement sensors in their inner ear to the brain. So going back to like that first slide, that would be that cochlear nerve. And it usually that helps correct problems with vertigo while attempting to preserve the hearing in the affected ear, so that, you know, maybe for younger patients it might be something that they do. One of the sources I found was a study where they had just over 250 patients and they performed audiometric testing, cervical vestibular evoked myogenic potentials, and ocular vestibular evoked myogenic potentials, caloric testing, and rotational testing. So the cervical and ocular tests, the VEMPS tests, the cervical one is where the patient is exposed to an oral stimuli in the form of the ipsilateral loud clicks by each ear. This is to get the opposite sternocleidomastoid to test for the myogenic responses. So if you're doing it in the right ear, you want it on the left side. Whereas the ocular one, the patient is exposed to loud clicks or a bone vibration applied to the central forehead up near the hairline to get a response. With these, and the caloric paralysis, or the caloric testing that was performed, they did an irrigation to each side, and if there was a symmetrical response to, like in the first test, the irrigation on each side, there was only one test performed. The article was a little bit harder to decipher, so they found correlations between the tests of hearing imbalance and the symptom duration, and then the pure tone average caloric paralysis and rotational chair phase were all positively correlated with the duration of the disease, but there were some weak correlations found. How I took that away was, without there really being a cure for this disease, there's a difficult correlation to be made between everything going on within the vestibular system with this disease. I do know a lady who was diagnosed in her late 20s, early 30s, I believe it was. I've known her for a very long time, and she had come back to the dance studio. She was diagnosed with it in her left ear initially. So for a lot of her dances, whenever she came back, she would only do a lot of stuff going towards the right, because going towards her left, she would lose her balance. She had the 2 shots done, the gentamicin and then the cortisone shot, and she also had fiddle, I need to have this written down with everything else I'm going to say. And she had the sac decompression. She got a lot of this stuff done before she was married, so she was able to do a lot more. Actually, right before she got married, she had been diagnosed with a bilateral Meniere's disease. So she still has to, like when she was dancing, she would still try to do stuff to her left so she didn't completely lose the entire function of being able to go that way, especially with being as young as she is. But that's what I got.